is my honor to welcome you all to the launch of the revised Health Professions Council of Zambia, HPCZ, National Healthcare Standards, and 6 subsidiary guidelines. We gather at an important moment in the continued strengthening of healthcare regulation and service delivery in Zambia. Now, the Health Professions Council of Zambia, now continued under the Health Professions Act number 17 of 2024, remains firmly committed to its mandate that ensures upholding of the highest standards by health professionals and health service providers. Today's launch reflects this broad and vital mandate, strengthening standards, promoting integrity, enhancing accountability, and ensuring that healthcare services across our country meet internationally comparable benchmarks. You are most welcome, and we appreciate your presence. So without further ado, I would like to invite the acting CEO and registrar of the HPCZ, Mrs. Mutinta Mwonga Musaila, to officially welcome us all to this event. Let's give her a round of applause as she comes forward.
Ladies and gentlemen, distinguished guests, the Health Professions Council of Zambia is established under the Health Professions Act number 17 of 2024 and is mandated to regulate the licensing of health facilities, the accreditation of health services, and the professional conduct of health practitioners. Central to this mandate is protecting the public and ensuring that health services in Zambia meet acceptable standards of safety, quality, and ethical practice. The National Healthcare Standards 2026 presents a significant milestone in fulfilling this mandate. This revision was informed by the evolving nature of healthcare service delivery in our country. Zambia's health sector has experienced the emergence and expansion of new models of care, including digital and telehealth services, domiciliary and home-based care, traditional and complementary medicine, artificial intelligence applications, and increasingly complex health advertising practices. While these developments offer immense opportunity, they also demand clear, modern, and enforceable regulatory standards. The National Healthcare Standards 2026, together with the subsidiary guidelines being launched today, respond directly to this changing landscape. Collectively, these instruments provide a coherent, harmonized regulatory framework that strengthens oversight while remaining responsive to innovation, investment, and service delivery realities. These standards were developed through an extensive, inclusive, and consultative process, including the Ministry of Health, statutory regulatory bodies, professional associations, service providers, academia, and cooperating partners. This approach ensured that the National Healthcare Standards 2026 and the subsidiary guidelines are practical, evidence-informed, and responsive to the realities of healthcare delivery in Zambia. Ladies and gentlemen, distinguished guests, I wish to express sincere appreciation to the Ministry of Health for its leadership and stewardship throughout this process, and to our cooperating partners and stakeholders for their valuable technical and logistical contributions. The National Healthcare Standards 2026 and the subsidiary guidelines are not merely regulatory instruments. They are practical tools designed to protect patients and communities, promote ethical and professional practice, provide clarity and predictability to service providers, and strengthen public confidence in the health system. Healthcare regulation is, therefore, a shared responsibility whose success depends on the collective commitment of all stakeholders to uphold these standards in the public interest. Ladies and gentlemen, as I conclude, as the Health Professions Council of Zambia, we reaffirm our commitment to implementing these standards transparently, consistently, and fairly, in close collaboration with the Ministry of Health and all stakeholders. I thank you for your attention.
That was a speech by the HPCZ Acting CEO and Registrar, Mrs. Mtinta Monga Musaila. It's now time to hear from the cooperating partners, and I now invite Mrs. Vivian Sakanga, Country Director for Amref. Let's give her a round of applause as she comes forward.
Today is a defining moment for healthcare regulation and quality assurance in Zambia. These revised standards and subsidiary guidelines are more than just technical documents, but a catalyst for innovation, inclusiveness, and job creation. They are meant to create consistency across the health system, protect the dignity and the right of patients, and ultimately strengthen public trust in health institutions. We are looking forward to the policies being translated into practice, and that is what these national healthcare guidelines will be providing. At Amref, we believe that strong health system rests on a competent, well-regulated, and continuously supported health workforce. Therefore, these revised standards align directly with our mission of catalyzing community-led, people-centered health systems while strengthening the health workforce. Ladies and gentlemen, we commend the leadership of the Health Professions Council of Zambia for steering a technically rigorous and consultative review process, which has culminated into the approval and eventual launch of the guidelines. We are happy that the guidelines reflect substantial improvements with several structural enhancements, notably among others, the 6 new subsidiaries guidelines that provide governance frameworks for innovation, including telehealth and artificial intelligence in healthcare. These reforms modernize Zambia's regulatory environment and position the country to proactively govern contemporary and future healthcare delivery models. Our support to the Ministry of Health and HPCZ reflects our commitment to enhancing pre-service and in-service training quality, strengthening continuous professional development systems, supporting mentorship and supportive supervision, improving regulatory compliance and inspection systems, and lastly, promoting quality improvement initiatives at facility level. The healthcare system is as strong as the health system that governs it. Therefore, by reinforcing regulatory standards, Zambia strengthens its entire health ecosystem from training institutions to frontline facilities. Distinguished guests, as Amref, we remain fully committed to supporting the Ministry of Health in strengthening Zambia's health system and advancing universal health coverage, strengthening primary health care, and investing in health workforce development. And today, our support has been made possible through our Africa Health Collaborative Program in partnership with the MasterCard Foundation. The collaborative is a co-created partnership to strengthen primary healthcare systems in Africa through health workforce development, transition to work, entrepreneurship development, and innovation in the healthcare system. Therefore, we do commit to continue supporting HPCZ and the Ministry of Health in building the capacity of the healthcare workforce for the implementation of these standards, to strengthen monitoring and evaluation of systems, provide technical assistance in quality assurance, support digital innovations that enhance regulatory oversight, and also facilitate knowledge sharing and learning platforms. Because we believe that this is collective effort and we are here to support. And beyond this, we believe that the impact is beyond the systems. It is about the mother delivering safely. It's about the child receiving accurate diagnosis and timely treatment. It is about the healthcare worker operating within clear, protective, and professional guidelines. It is about communities receiving care they trust. And so as we witness the launch of the revised national healthcare standards and the subsidiary guidelines, let this moment signal renewed commitment to quality, to professionalism, to accountability, and to collaboration. We are happy to work alongside the Ministry of Health and HPCZ in this journey of strengthening the health systems and advancing the health workforce development in Zambia. Together, through this partnership and shared responsibility, we can ensure that the quality of healthcare is not a privilege, but a standard for every Zambian. Thank you.
Thank you very much.
I'm pleased to address you at this important event marking the launch of the revised National Healthcare Standards 2026 and the accompanying subsidiary guidelines. The Ministry of Health attaches great importance to effective regulation as a cornerstone of a functional, resilient, and people-centered health system. Quality health care does not occur by chance. It results from deliberate standards, strong oversight, and shared accountability. Ladies and gentlemen, distinguished guests, the National Healthcare Standards 2026 and the subsidiary guidelines are therefore both timely and strategic. They are aligned with the Health Professions Act number 17 of 2024, the 8th National Development Plan, and Zambia's broader agenda towards universal health coverage. They also respond to emerging realities within our health sector, particularly the expansion of digital health, home-based care, artificial intelligence, and diversified service delivery models. Importantly, these instruments strike a necessary balance. They promote innovation and growth within the health sector while ensuring that patient safety is adhered to, professional accountability, ethical practice, and data protection remain paramount. Ladies and gentlemen, distinguished guests, as a ministry, we reaffirm our full support to the Health Professions Council of Zambia in the implementations of the NHCS 2026 and its subsidiary guidelines. Ladies and gentlemen, distinguished guests, it is now my honor to invite the Acting Honorable Minister of Health to deliver the keynote address and officially launch the revised National Healthcare Standards 2026 and the subsidiary guidelines. I thank you.
Senior government officials present here, all our cooperating partners present, distinguished guests, ladies and gentlemen, members of the press, it gives me pleasure to preside over the official launch of the revised National Healthcare Standards 2026, together with 6 subsidiary guidelines developed by the Health Professions Council of Zambia in collaboration with the Ministry of Health and its partners. The 6 subsidiary guidelines include the Telehealth guideline, the Artificial Intelligence guidelines, the Continuous Professional Development guidelines, the Advertising guidelines, very important, and Domiciliary and Home Care guidelines, and finally the Traditional, Complementary and Alternative Medicine guidelines. Have you heard? Traditional, Complementary, and Alternative Medicines guidelines. So very important. We want to ensure that we carry everyone along and make sure that those who are accessing things like acupuncture, these supplements, are all regulated and they are well protected. So this is the reason why these guidelines are important. Healthcare remains one of the most critical pillars of national development. The quality, safety, and integrity of health services directly affect the well-being of our people. The productivity of our workforce in the health sector and public confidence in institutions cannot be overemphasized. For this reason, standards matter. Ladies and gentlemen, distinguished guests, the National Healthcare Standards of 2026 represent a major advancement in Zambia's efforts to strengthen healthcare regulation, This revised edition responds to the realities of modern healthcare delivery. It recognizes that healthcare today extends beyond traditional facility settings to include digital platforms, home-based services, specialized centers, and innovative models of care. Ladies and gentlemen, distinguished guests, the subsidiary guidelines being launched alongside the National Healthcare Standards of 2026 provide regulatory clarity in key and emerging areas, including telehealth, digital health services, traditional, complementary and alternative medicine, ethical advertising of healthcare services, domiciliary and home-based care, the safe and responsible integration of artificial intelligence, and continuous professional development for health practitioners. Together, these instruments ensure that innovation in healthcare proceeds within a framework that safeguards patients, upholds professional ethics, and strengthens public trust. Ladies and gentlemen, distinguished guests, the government of the Republic of Zambia, under the able leadership of the President of the Republic of Zambia, Mr. Hakainde Hichilema, remains committed to and resolute to a regulatory environment that is fair, transparent, and forward-looking. We recognize the importance of encouraging investment and innovation while ensuring that all healthcare services meet acceptable standards of quality and safety. I therefore call upon all health facilities, practitioners, training institutions, and service providers to familiarize themselves with the National Healthcare Standards of 2026 and the subsidiary guidelines, and to comply fully with these provisions. Regulation is a shared responsibility, and its success depends on collective adherence and cooperation. Ladies and gentlemen, distinguished guests, I commend the Health Professions Council of Zambia, the Ministry of Health technical teams, professional associations, statutory bodies, and cooperating partners for your dedication and hard work in delivering these important instruments. May these instruments strengthen healthcare quality, safeguard patient safety, and contribute to a resilient and trusted health system for the benefit of all Zambians. Ladies and gentlemen, distinguished guests, it is now my honor and privilege to officially launch the revised National Healthcare Standards of 2026 and the 6 subsidiary guidelines. I thank you and God bless you.
Thank you very much, guest of honor. I would like to invite the high table to come down and join the guest of honor right in front here.
Just a brief on what the National Healthcare Standards that we have revised and launched. We are launching today has changed, just the key highlights. We have been operating with National Healthcare Standards which were done in 2021, and they had reached their lifespan. And there were also new emerging issues in healthcare that needed to be addressed and bring up regulation on how best we can operate as a sector. Before I start, I want to thank our sponsors who put in so much money in making this document to be what it has become. And among them is Amref Health Africa, ICAP Zambia, and Starkey Hearing Institute that generously funded us, paid for our allowances, paid for venues, and all the logistics that have gone into this document. Without them, I think the council would have had quite a tough time to actualize this document in the time frame that we did. So with that, please, can we give them a hand of applause? So as I introduced myself already and been introduced, those are the key highlights. What is in the NHS 2026, and then we also have subsidiary guidelines that we all need to pay attention to, and then we also make clarifications on the implications of licensing and accreditation. Why did we revise the 2020 version? We've had a lot of evolution in the last 5 years in the healthcare and the new delivery models. We've had emerging issues from technology to just treatment guidelines that have been changing. And as a council, we were a little bit behind, and we needed to keep pace with that and come up to date so that everybody is playing from the same book and the services are being provided accordingly by everybody in the same standard. We also are aware that the Health Professions Act was amended in 2024 from the Health Professions Act of 2009. So now we are operating under the HPA number 17 of 2024. And those need to do alignment of the standards according to the new law that gives us power to operate and do what we do. Some of the key issues: domiciliary care, which before we didn't really clearly have well-defined standards on how domiciliary and home care is provided, and there was growing demand to provide such a service. So how were we going to regulate this and manage it properly so that it's done under safe and ethical standards? Digital health and innovation. My favorite, artificial intelligence. And everybody now is hooked to AI, and the health services have not been spared. So we have now AI interpreted radiology, AI interpreted lab results, and also suggested methods of care and personalized care using artificial intelligence. So we thought we needed to have a regulation to guide how this is going to be implemented. Some facilities, of course, are ahead of others, but as a regulator, we couldn't just lag behind and wait for everybody to come on board. We also have emerging specialization and advanced care. Stem cell care is on our doorsteps. And how best can we address that? And how best can we manage it and regulate it so that there is no unethical care that the services are providing? Transplant surgery, the private sector is trying to come on board fully fledged. So how best do we regulate that as well? So these emerging specializations and some of the issues compelled that these standards are revised to keep up to date. Other issues that have come up are complementary care. So we have seen care that borders on health services, but not necessarily in the mainstream of healthcare. So that complementary care also needed its own tool or its own set of guidelines and regulations, and as a council, we thought it was imperative that we include. So amongst the subsidiary guidelines that we'll be launching today is the famous TCAM, Traditional, Complementary and Alternative Medical or Health Services.
First and foremost, I want to convey my sincerest gratitude to the Acting Minister of Health, represented here by the Permanent Secretary, for officiating at this very important event, and for the continued leadership and commitment demonstrated towards strengthening healthcare regulation, quality, and most importantly, patient safety in our country. Your presence, guest of honor, and message today has given us both direction and confidence, particularly to those of us who are charged with the responsibility of delivering services in the field. I also want to express my gratitude to the Ministry of Health overall for the unwavering stewardship and policy guidance. And also let me express my sincere gratitude to the Health Professions Council of Zambia under the leadership of the Acting Registrar and Chief Executive Officer for this work they have done, for the technical diligence and inclusive approach that was taken in developing the revised National Healthcare Standard for 2026. And of course, the accompanying subsidiary guidelines. Our commitment to compliance, continuous improvement, and collaboration with the Ministry of Health and the Council. We recognize that regulation is not a constraint, but a vital enabler of quality care, public trust, and professional integrity. Finally, I wish to extend my appreciation to all the stakeholders, the cooperating partners, organizers, and the participants who have contributed to the success of this launch. Your collective efforts have made this event both meaningful and impactful. With these few words, and on behalf of all institutions and the health practitioners, I say thank you.